Alaska, the frigid northern extremity of America. Come April, the harsh winter begins to loosen. The seemingly endless nights grow short, and the frozen wilderness. In the heart of this majestic setting lies a whose weary inhabitants eagerly Montgomery Memorial Hospital watch, and in this remote hospital toil two come this and in the whose one and in
We will now begin the tutorial. I will explain the basic treatment of affected areas. There are 3 topics: incisions, suturing, and bandaging. This patient is a mannequin, but please perform the treatment as if it were a human patient. Now, let's begin the first topic. First, we will use the antibiotic gel to disinfect the area where we will make the incision. This gel is a multi-purpose salve that is used for disinfecting, clotting blood. Please select the antibiotic gel now. Do you see the yellow guideline where the incision will be made? The sections disinfected by the antibiotic gel will turn from yellow to blue. Try and disinfect the guideline until it turns completely blue. Hold the A button and move the pointer to apply the antibiotic gel. We are now done disinfecting it. Next, we will use the scalpel to make an incision. Now, please select the move the pointer to the end of the guideline and press the A button. Hold the A button and move the pointer along the guideline. Move the pointer to the edge of the guideline and then press the A button. That is how to make an incision. Now, let's try it again. The guideline hasn't been completely disinfected yet. The incision has been made. Before we move to suturing, let's try making another incision. This brings the incision tutorial to an end. Next is the suturing tutorial. Now, let's begin. The tools used to suture a wound are: please select the suture. Large incisions are closed by hold the A button and make a large zigzag. Suture the incision as if you're trying to close both edges of the open gap. This is the procedure to follow when suturing. As you just saw, the needle and thread are used. Now, let's try it again. You've successfully sutured the incision. Hold the A button and move the pointer in a zigzag. The same procedure is used to close large laces. Now, let's try it again one more time. That's the end of the suturing tutorial. Bandaging is next. This is the last part of the tutorial. Bandaging is a treatment done at the end of almost every. First, let's disinfect the sutured area with the antibiotic. Please select apply the antibiotic gel to the sutured area to treat the hemorrhaging. The sutured area has been disinfected. The bandage is on the left side of the screen. Move the pointer to one end of the sutured area and hold down the A button. Then, move the pointer to the other end. Don't make the bandage too long or too short. Also, be careful of the angle you apply the bandage at. This is how you tape sutured incisions. This is the step you will use to finish an operation. Now, let's try it again. It's still hemorrhaging. This is the last time. Let's try it without any hints. Please apply the tape to cover the entire sutured area. Please adjust the direction and bandage. Well then, let's perform the incision, suturing, and bandaging treatments that we practiced. You've made the incision. Now to suture it. Suturing complete. Finally, bandage the incision. It's still hemorrhaging. All the basic act. Great work. That's the end of the Welcome to the tutorial. This time, I'll show you something similar to an actual operation. The tools that I will be explaining are the syringe, suture. First, select the syringe. The syringe is a tool used to inject. Right now, there are inflammations in. Let's try injecting these inflammations with an The anti-inflammatory is the blue bottle at the bottom. Move the pointer over to the bottle with the blue metal. Hold the A button to fill the syringe with medicine. Now, move the pointer to an inflammation and press the A button. The inflammation has been treated. Please inject the anti-inflammatory into the inflammation. Make sure to inject the medicine directly into the inflammation. All the inflammations have been treated. That is how you inject medicine. Lacerations have occurred in the operating area. To treat the lacerations, use the sutures. Now, select the hold down the A button and move the pointer in a zig. Once you've sutured from one end of the laceration to the other, let go of the A button. The laceration has been sutured. Please treat the other lacerations in the same way. All the lacerations have been sutured. Just like closing an incision, a laceration is closed by using a... Let's continue and perform a treatment to remove shards of glass. To remove foreign objects from the... Now move the pointer over the glass shard and keep holding both buttons and pull the shard out in the... Now carry it over to the tray. You need to let go while the shard is above the tray. Please start over. The glass shard has been extracted. Now remove all the other shards using the same method. You can't let go of it until it's over the tray. Start again. All the glass shards have been but now there are wounds left behind from where the glass had. Use the antibiotic gel to treat small. Now, treat one of the small wounds with the antibiotic gel. The wounds have been treated. Let's practice what we've covered here once more. The inflammations have been treated. Now, move on to the other areas. The glass shards have been removed. Don't forget to treat the wounds with the antibiotic gel. The wounds have been treated. Please move on to the other areas. The lacerations have been sutured. Great work! That brings this tutorial to a close.
They're here! Hurry, Val! The patient's a 40-year-old male. He has a gash on his chest and he's losing blood fast.
How is he injured?
He ignored the tour guide's warning and picked a fight with a grizzly. His blood pressure is 70, his heart rate's 130, and he's lost consciousness.
Got it. Can you hear me? We're going to take you into the hospital. My name is Valerie Blaylock. I'll be treating you. Don't worry. You've been badly injured, but it's not hopeless. In fact, you're quite lucky that there are 2 skilled doctors in a remote place.
I've confirmed the patient's blood type and blood count, Dr. Vaughn.
Do we have enough blood on hand? If not, then make arrangements. Have Eric make a quick trip to the blood. Now what about the x-rays?
It looks like he has 2 broken bones. We'll have to rebuild them. Nurse, have an ample supply of antibiotic gel ready.
It's hard to believe, but situations like this don't seem to faze me anymore. And here I thought I was gonna be able to kick back and enjoy the northern lights every night.
Oh, quit your whining.
Doctor, the patient's vitals are dropping.
All right, let's get down to business. I have dinner reservations.
Let's begin the conference. The patient has suffered a large laceration extending from his right shoulder to his chest. He also has a compound fracture in his right arm. The bone fragments seem to be aggravating the surrounding tissue. There are 2 objectives in this operation. The first is to stop the bleeding, and the second is to retrieve the bone fragments, reform them, and set them in place.
The blood won't be arriving for a while.
We don't have time to wait. We have to begin the procedure immediately.
I agree. I'm ready to begin.
Okay, let's begin the operation. The patient's vitals are low. Please use the syringe to stabilize them. Please inject more. We need to get his vitals up. His vitals have been stabilized. Begin treating the external wound. First, you'll need to sew up the laceration with the sutures. Begin suturing the remaining lacerations.
So far, so good.
The suturing is complete, but there are still some small wounds left. Please treat them with antibiotic gel.
That takes care of the external wounds. Let's move on to treating his arm.
Apply the antibiotic gel to the incision guide. The area has been disinfected. Now, make an incision with the scalpel. Begin treating the fracture. First, retrieve all the bone fragments. Use the forceps to remove the fragments that are lodged in the tissue. Place the fragments on the tray. The first fragment has been removed. Don't forget to treat the wound. The third fragment has been removed. Please treat the wound as well. All of the bone fragments have been removed. Please treat the remaining wounds now.
Looks like this bone is warped.
Let's see if we can reshape it with the forceps.
Now we need to reconnect the bone fragments.
Twist your wrist to maneuver the fragment into the correct position. That's not the correct location. Please look at the shape of the bone fragment more carefully. You've successfully placed the first bone fragment. Please continue.
the patient's vitals. It's like a jigsaw puzzle. We don't have much time.
All of the bone fragments have been properly placed. Now, please use the antibiotic gel to affix them.
That does it. Let's close them up.
Now suture it in the same manner as the laceration. Okay, we need to bandage the sutured incision. Use the antibiotic gel to stop the bleeding
We have to
before we
hurry.
bandage him up.
The bleeding stopped.
Apply the bandage from one end of the sutured incision to the other, and we'll be finished. Good work, everyone. Good work, Doctor. I don't know how you can remain so calm during an operation. I'll transfer the patient to room 3.
He'll need to remain here for about 5 days. Should I send a bill for a guided tour of Montgomery Memorial to his travel agent?
Good idea, but don't serve him anything fancy. We don't want him getting too comfortable.
I see that the operation went well.
It did. So when are they going to give us the key to the city? We are making Alaska safe for tourists, after all.
I'll take it from here. That is, if you don't mind stepping aside for an old-timer like...
No, not at all. Just let me know if anything comes up. I'll be at Lucky's, enjoying some grilled salmon.
Well, I don't let my stomach call the shots, so I'd be happy to stay a little longer, sir.
That's quite all right, Dr. Blaylock. There's nothing more we can do for him for the time.
Beginning the tutorial. This time, I will explain the use of the laser, the ultrasound, and the drain. First, select the drain. The drain is a tool used to clear away liquids, such as blood or pus, from the area of operations. Let's try draining the red pools of blood here. Move the pointer to the pool of blood and hold the A button. If you move the pointer while holding the button, you will be able to drain from a wider area. All the blood pools have been treated. These small tumors were hidden under the blood. The laser is used to burn away small tumors like these. Now, select the laser. This is used in a similar way as the drain. Move the pointer over a small tumor and hold the A button. All the small tumors have been treated. However, after burning away the tumors, small wounds are left behind from the laser. These small wounds can be treated with the antibiotic gel. Please treat all the small wounds using the antibiotic gel. The area is now clear. However, There will be times when something lies hidden beneath the surface out of view. The ultrasound is the tool used to locate hidden objects. Select the ultrasound now. Try moving the pointer around. If something is hidden, we caught a glimpse of a shadow. It appears to be a tumor. Move the ultrasound towards the shadow and press the A button. The shadow will stay displayed like this for a moment. Now's the chance to make an incision across it with the scalpel. Now we can see the tumor. Using the scalpel and the ultrasound like this will allow you to find and let's treat this tumor. First, we need to drain the cytoplasm from. Use the drain to remove. Please select the drain. Next, use the drain on the tumor. The cytoplasm has been drained from the tumor. But if time passes, the cytoplasm will seep out again. Let's cut the tumor out with the scalpel. We follow the guideline and carefully cut around the tumor with the scalpel. The tumor has been cut out. Use the forceps to pick it up and carry it to the tray. The tumor has been extracted. But there is still a wound left behind from where we removed. A synthetic membrane must be used to treat the excision area. Select the forceps and carry the membrane from the tray and place it on top of the wound. Next, let's affix the synthetic membrane. Apply the antibiotic gel, covering the entire synthetic membrane. The membrane has been firmly affixed. This completes the tumor removal procedure. This is the basic process to remove tumors, so be sure to remember it. That wraps up the explanations in this tutorial. Let's practice everything we've covered once more. All the blood pools have been treated. Use the antibiotic gel to treat the small wounds left behind after burning the small tumors. The large tumor is all that's left. Let's use the ultrasound to look around. There's the tumor shadow. Use the scalpel to make an incision across the shadow. We'll need to start over. Use the ultrasound again. Drain the cytoplasm from the tumor. The cytoplasm has been drained. Now use the scalpel and make an incision along the guideline. The tumor has been cut out. Select the forceps to extract it. There is a wound left behind. Place a synthetic membrane over the excision area. Now affix it with the antibiotic gel. work. That brings this tutorial to a close.